Hello YouTube, my name is Wishby. This is my first video. I am 275 to 278 pounds, BMI 46. I am 5'5", and I am looking into having weight loss surgery. I'm looking into more information on the lap band, the gastric sleeve, and the gastric bypass. I have been overweight most of my life, since puberty. So I think I started gaining weight about 13, 14. Yeah, 13, 14. And of course, like everyone else, have tried all the diets, all of the, well, I don't know if all, but I've tried Weight Watchers, LA, Atkins, tried so many, including, the bad ones for you, 18 and 4, um, drink water, like liquids only, I don't know, the cabbage soup, all of them, all of them, cabbage soup and juice, tried juicing. So I think right now is the time to take this to another level of seriousness. I need to lose weight, because of my health. I have, about a couple of months ago, like on February, late January, I I got extremely sick. I was very, very tired all the time. I was working, but I was very, very tired. I could not get down the stairs, without getting tired. Could not get up the stairs without, and so even going down to get my car, with my son, he would be like, okay, I have a 2-year-old son, so I would walk him to the car, and by the time I get to the car, I was so tired that I couldn't, I would have to put him in the car and just put my head against the hood and be like, I just I need a minute. I didn't even have the strength to get in the car, even to sit down. It was that bad. And then I also had like stomach issues where I was throwing up, whatever I ate, I was throwing it up. So I went to see a doctor, and we had several tests done. We had blood tests. I had, I guess, a whole physical, but blood tests. We also had ultrasound. We had, yeah, ultrasound, blood tests. She sent me to see a gastroenterologist. She said to me, because I had blotchy, like dark, spots on my skin, and then she said that these could be the result of vitamin deficiencies, and that your body, overworking. So she sent me to see a nutritionist. She was even saying like even these were, because sometimes you're like, oh, these are like my fat rings, but she's like, no, no, these are signs of like what is being done to your body, like the unhealthy signs. And so when I went to see the nutritionist, we did talk about like what I needed to eat, my culture and what's important. And um, one of the surprising things the doctor had said, is that to maintain your weight, you have to be eating 5,000 calories a day. I'm like, what? Where? Like, I do not eat 5,000 calories a day. Like, um, so, and I still don't agree with that, but I definitely don't eat 5,000 calories a day. But she was, the nutritionist was like giving an example of what you ate, and of course, we all know, the bad culprits, the sandwich and the junk food. So, but basically, the test results were, the blood test was that I have iron deficiency. I also have a blood disease, going back a little bit. I have a blood disease called thalassemia. That one, the thalassemia I knew about because, I had surgery a few years back and did see a blood specialist then that diagnosed me with that. So, so I had, at this point, I had low iron. A normal person's iron is 40. Mine is was 16 a couple of months ago. Um, the hemoglobin was 8.0. Now, normally people are like 15. But because of the thalassemia, my hemoglobin numbers never really go above 10. I don't even think I've ever been an 11, but 8 was pretty low for me, and I think any lower is like straight to the hospital because I was already, being dizzy, and so I think if it went down a little bit lower, I probably would be in the emergency room. So, but basically, you know, and then the ultrasound results were that I have gallstone. And then I also went to see a gastroenterologist. He did an endoscopy, and that was good news because my stomach was fine. There was no cancer, no ulcer, nothing. So that was clear. And she sent me to see a sleep study specialist, and the sleep study specialist sent me to do a sleep study or a sleep specialist. Sleep study and the sleep study. I remember the went one night, and it was funny because my aunt was having her second test. you know, so the joke was between us was like, oh, we're gonna start inviting the whole family because at this rate, because we had the rooms next to each other. So, but basically, so the next day, like by 1 o'clock, I got a call from the sleep doctor. It was 11 o'clock. It wasn't even 1 o'clock. From the sleep doctor saying, can you come back and do the next test? And I guess it's pretty bad to have the doctor call you right away and be like, okay, come back. And I knew what the news would be. And so I did that test, and I had to stay away, of course, from my family for a second night. I have a 2-year-old son and my husband. So it was pretty hard staying away from them for 2 nights in a row. And so the next week, I think, when I saw the sleep specialist, she showed me the sheet, and the sheet was just like, oh my God, this is where you woke up. This is how many times you woke up. This is how many times you stopped breathing during the night. And of course, it was just like black, 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 purple, 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 just horrible. Like, but then she said the good news was that I responded to the when they put the oxygen mask, so they had a level where it was it was good, and I responded to the therapy. So we're gonna get me a machine, and which I got last week. I got the machine last week, and this is tonight's like my 5th or 6th night with it, and I still don't. I'm not used to it, and I don't like it. The air is too much. It's like, oh, anyway. So hopefully in 2 weeks I get used to it. But so this is where I'm at. Um, and then the sleep study specialist said my breathing during the night went down to 56%. And she sent me to see a pulmonary specialist. And now the pulmonary specialist is like, the breathing going down so low, has relations to the thalassemia and the iron being so low, meaning like, with the iron being so low, it, I don't have, just lack of oxygen going through my body. So, um, and I was hoping, my regular doctor and I had talked about not getting a transfusion. It's like an iron transfusion, and I really didn't want to do any blood, anything like that. But it's not a blood transfusion; it's an iron transfusion. And so the pulmonary specialist that I saw said, it would be a good idea to gauge as to like which one, like what's your base level, and that the iron deficiency is not the reason why your breathing is going so low. And also, if I'm thinking about having surgery, no surgeon is gonna touch me with a hemoglobin 8 point, anything. Like right now, I think for my last blood test it's 9.1, but that's still low. They always wanted it the highest possible, so I'm definitely gonna get some transfusion. So I'm gonna see the hemoglobin specialist now. The list of doctors is just like, okay, I'm saying this. I'm like, I think I'm up to 6 now. Um, So I'm pretty worried about my health. My husband is worried about my health. And I have a 2-year-old son that I would like to see grow up and that I want to play with. I want to play with my son. He likes to play and I can barely do 2 minutes. And I was telling my mother this. I'm like, it's like, he's outside and he wants to play and after 2 minutes, mommy's done. Mommy's like, oh, mommy's tired. Mommy can't keep going. And that's not fair to him. And I think I've said this in my last video. I like that's not fair. That's not fair to me. That's not fair to him. So that's one of the reasons I'm thinking about this surgery. I'm thinking seriously about getting rid of this weight. I've done the exercising. I've done all the different diets and it's hard to lose 40 pounds and then be very excited about losing 40 pounds and then to see it crawl back and you're right back where you started from. So well, worse. And I mean, I remember after the Atkins diet, I did Atkins at one point. That's why I'll never do that one again. um it was good. I was like, oh my God, I could eat bacon. That's like actually, you can eat bacon. And then not too long after, it was just like, I don't know, for whatever reason, I think I tripled the pound, I lost. It was just like I gained triple. It was just like, okay, you lose, you lose, you lose, and I gained it right back. Excuse me. And so I definitely want like a permanent solution. And I've been watching all of the YouTube videos and the success stories and also the complications. I really concentrated on the complications and people's. I think it was very inspirational to see a lot of the before and afters, but I was really concentrating on the between, what the people were going through, and they inspired me because it wasn't easy, and I don't think it's gonna be easy, but you know I want to try, and I definitely want to be one of those success after stories that lost 100 pounds. So that's my goal. This is my vlog of accountability. This is me saying to me that you are responsible to lose this weight so you can be here for your son and for your husband. And this is it. So I'm joining you guys. I've been very much inspired, and I hope to be one of those, like, that inspires somebody else, and and that inspires even myself. Like, that's my goal. That's my statement of accountability. And this is where I'm at. So on Wednesday, I think I have to see the hemoglobin specialist. I got to have a couple of the gallbladder surgeon, and then I have the seminar on the bariatric seminar. So Wednesday afternoon, I have a full afternoon. So I'll try to do a video when I come back, or on Thursday. And then I have the one for the surgeon, for the bariatric surgeon. I have it on May 15th. So that's all for now. I don't want to go long again. So good night, YouTube.